As you're sitting down, planning out exactly what content you're going to cover in your next class, usually what happens is we take a look at our learning objectives, we look at our resources that we're using to align our content with the actual evidence when we're teaching our students, when we're planning out these interactive activities for our students. But how many of us spend countless hours developing these exciting activities? And then we get to class and students don't connect with the content in the way that we expected them to. Well, in this snapshot, we're going to be talking about exactly that. How do we ensure there's strong alignment between the content we're developing for our students and the connection that they make to those concepts? How do we integrate this social cognitive theory that we know Bandura and many others in the research have talked about as so critical, especially for nursing education? How do we make sure that the dots actually connect, that we're able to guide students through that learning process? Denzel Washington shared this amazing quote that I want to share with you all. And it simply states this: anything that you practice, you get good at, whether it's positive or negative. All right, I'm going to say that again because I thought it was so profound. Anything that we practice, we get good at, whether it's positive or negative. Now, when you reflect on the evaluations that you get from your students, we often process what could we have done differently. But how many of us really take time at the end of every class to reflect on what worked well and what didn't work so well? Well, today is the first step that you're going to take to reflecting more in real time as we think about how do we get better, not only for our students, but for ourselves. At Dr. Sellers Educate, we focus on supporting you on your journey to nurse educator excellence until you are successful, no matter how long that takes. Some of us were on the journey for 7 or 8 years. That was me. Other colleagues have been on the journey fewer years, or maybe some of you all have been on the journey even longer than that. Well, here's the good news. This is a no judgment zone, and we want you to take two simple steps as we get into our content for this snapshot. First, we want you to pull out Billings and Halstead Teaching and Nursing, the sixth edition. That is the one that we're referencing in our snapshots because this is the edition that the exam writers reported to us that they used to write the current exam. Okay. And then, second of all, go ahead and print out that study worksheet. It's listed right here in the description. This is going to help you stay focused as you move forward on your journey. Okay. So you have Billings and Halstead, you have your study worksheet. On your worksheet, I want you to write down today's date, whatever date you're watching the snapshot. This is going to help you reflect on the content that we're going to cover during our time together today. Okay. And then the objective. What is it that you want to accomplish now that you know we're talking about social cognitive learning theory and that we're going to identify what steps you should take to ensure that you are indeed connecting content with your students and the evidence in a way that's going to allow them to apply these concepts and ultimately analyze the nursing practices, the decisions they're making when they are providing direct patient care. All right, so let's go ahead and take a look at our content as you think about what your next steps are going to be. And as you pull out those resources, specifically honing in on some of these, the thought-provoking question, which we will take a look at, and just thinking about where you are on your journey. All right, hopefully you've had a chance to do your self-assessment. That's the first step is you're mapping out what your next steps are going to be. Take a look at the detailed test blueprint that is on the nln.org website. Okay, if you need more help in figuring out exactly where to go, just email us, info@drsellerseducate.com. Social cognitive theory, also known as SCT, and teaching. So how does it align? How do we really unbreak the trap? How many of us feel like we're trapped sometimes, right? When we have done all this work with our students, we show up, they show up, but they're not connecting the dots, and we can see the deer in the headlights look on their face. That's what we're talking about. How do you unbreak being in that trap where we are focusing on how we enhance learning with our students, but we don't quite accomplish our goal? Ultimately, what we want to happen is that students are able to make safe patient care decisions in the clinical setting in a way that they feel good about the care that they're providing and also that they are validated as being competent. Transition to practice is a real important focus as we think about how to get our students ready for the clinical practice setting when they graduate. Yes, we want to get them ready for the NCLEX exam. That's step number one. We know that they must pass the CNE exam. And we also want to get them practice ready. Well, it means that we've got to engage in the social cognitive learning theory, and we know this is a critical step in the student's learning journey in understanding clinical judgment and ultimately being able to collaborate with the team that also is competent and that they're able to make as a group in a collaborative way the best patient care decisions that are needed. All right, so let's take a look at our thought-provoking question. Which of the following scenarios best exemplifies the concept of self-efficacy as explained in social cognitive theory? So we have A student observes that their preceptor performing a new clinical procedure and believes they can perform it as well. B, a nursing student feels motivated after receiving positive feedback from their instructor but remains unsure of their ability to replicate the skill. Or C, a student nurse is repeatedly exposed to the procedure in the classroom setting but does not feel confident enough to perform it on patients. So I want you to write down what you think the best answer is to this question. And for all of the questions on the CNE exam, you want to ask yourself two things. Number one, what is this question really asking me? And then second of all, what is it that I know for sure about content related to this question? All right, and then we'll keep going. And before we wrap up our time together, we'll make sure we come back and answer this question for you all and see how close you got to the correct answer. The NLN Hallmarks of Excellence, this is a copyrighted model for them. You can go to their website and find more details about the full model, but we're focusing on continuous quality improvement. This is the hallmark that we're going to hone in on as we explore our concepts for today. So what is it that we're focusing on to help enrich that learning experience with our students? How do we support the success of students' ability to really apply the learning that we have engaged with them, collaborated with them on the journey in the classroom? We don't want learning to stop in the classroom, right? We want it to continue. So how do we engage them in this continuous learning process in a way that really empowers them to have the confidence that they need to make safe patient care decisions in the clinical setting? Well, first of all, it's a key concept, a key component of this model is called observational learning. Now, you may wonder, what does that really mean? Well, it simply means that we want to engage students in a way that allows them to observe the evidence-based practice following the steps that are identified in the literature. What else is it that we want to follow up on or we want to engage in? Well, we want to role model these practices also in the clinical setting. This allows students to ask questions. We can also allow students to have some of this hands-on experience in the simulation setting, right, where students can actually practice the skills that are identified in the evidence, and we're able to give them feedback. This is the coaching part. We're also able to role model reflective practice, even in the classroom, that carries over into the sim setting where students are debriefing about the observation that they had or the hands-on experiences that they had in the actual simulation experience. Another component of observational learning is that guided reflective practice. So when we have a post-conference with our students, that's a way of guiding reflective practice. And then we want to carry it over or allow our students to carry it over into the reflective journal process for a post-clinical experience. These are all great teaching strategies that you want to consider and integrate into your everyday work that specifically aligns with the social cognitive theory or SCT that is associated with Bandura's work, just as one example. And then the last element that we want to focus on as we wrap up our time is self-efficacy. Well, what does this mean? Exactly what it sounds like. It is the student's belief in their ability to succeed. This is crucial to help students build their confidence and to also validate our effectiveness in supporting students to comprehend these concepts in a way that allows them to make safe patient care decisions. Another point of self-efficacy is that self-assessment process. Now, for us, for many of you that are on the journey, either towards C&E for the first time, or for us that are on the renewal of the certification, it's a continuous quality improvement journey that we're all on because we all want to get better every single day. Well, what does self-efficacy look like for us in nursing as nurse educators? It is doing that self-assessment, using the blueprint, and to identify what are those behaviors that are explained in that blueprint that's associated with our behaviors that we're demonstrating in our everyday work. So self-efficacy, yes, there's a huge component related to students' ability to really feel confident and to be competent in the practices that they are engaging in, but also our ability to be effective and create a positive learning environment for our students. You want to think about today, what are some of the self-efficacy behaviors that you are encouraging within your students? Are we giving them timely feedback? Are we coaching them and facilitating them as a partner on the learning journey? Okay, so those are some of the behaviors that you want to consider as you're thinking about how we can better support self-efficacy and also engaging students to be more responsible for their learning, providing those observational learning experiences with our students so that we can help advance their knowledge level, scaffolding their learning, considering Bloom's taxonomy that's on pages 188 through 190 in Billings and Halstead. All right, so let's take a look at our thought-provoking question. If you chose A, you are correct. A student nurse observes their preceptor performing a new clinical procedure the key word was exemplifies, best exemplifies the concept of self-efficacy, right? Because we just talked about self-efficacy really is that student's confidence in their competence based on our demonstration of those skills. We want to role model those skills for our students so they can not only ask us questions before they perform that skill, but they can actually see that specific skill being demonstrated. Now, here's the good news. If you didn't choose the correct answer, we don't want you to be discouraged. The reality is we don't write questions for the NLN exam. However, we do provide thought-provoking questions here on our channel, and we want you to think about the rationale for the incorrect answer and the correct answer. Your best step in supporting a successful C&E exam, the first attempt, is to take two steps. Number one, follow that 7-week study plan that is listed, and you can see the link right here in the description. It's included in our workbook. And the second step is to invest in yourself by committing to the time that is needed to achieve success on the C&E exam. And that is also in the handbook. So using those right resources is a part of your journey as you move forward, specifically using Billings and Halstead as your primary text. Time is our most valuable asset. Once it's gone, we can't get it back. Our goal is to help you streamline the process to move forward with ease. Not that it's going to be easy, but you're moving forward with ease by using the right resources, maximizing your time by following the 7-week study plan, and identifying exactly the number of hours that you should use, at least as a start, to close your knowledge gaps. 64%. That was the percent of nurse educator colleagues in 2023 that were successful on the C&E exam. We want you to be in that percentage, okay? And your ability to do that is going to be based on your commitment to achieving excellence, okay? So whether 60%, 63, or 64, our goal is to help you achieve success no matter how long that takes. We look forward to seeing you in our next snapshot. Email us if you have questions, info@drsellerseducate.com. We wish you all the best, and we look forward to seeing you the next time. Have a great one, everybody.